Well, hello, everybody. Well, welcome to this masterclass on thyroid health. So this is every month I've been making some form of masterclass where I donate some time and talk about some significant topics that I work with on a daily basis in my clinic. So it's a monthly thing. I started a few months ago, and well, maybe it's a year ago already. I'm not too sure, but it's really where I dig into topics that are somewhat complex, and I try to compress the topic as much as I can in 40 to 50 minutes, 40 minutes to an hour. I think the last one was about 45 minutes. So that's the goal today, is to talk about thyroid health, but talk about symptoms and try to make it absorbable for someone who maybe, for everybody, somebody who hasn't, to keep both parties engaged, someone that's really, really knowledgeable about a topic, and someone who's brand new at it. So I'm going to try to do a little bit of that today. I don't have time to answer questions while I'm talking. As you can see, when I was playing with the technology, I get distracted. So I can't answer questions through this because it's just me. But there'll be, you can always email me. All that information will be following this at the end of the video today. So that's what we're going to do. I'm going to share my screen here so we can jump right into it. So the world of the thyroid. There's a lot to it. But before we jump into all this, a little bit of my background, so you know who's speaking to you about this topic. My background, for those of you who don't know me, my background is in chiropractic. I actually started doing a little bit of chiropractic again in the office. I haven't been doing it for years, but we've had some inquiries. People want some help beyond functional medicine, so we're doing a little bit of that. But that's my background, chiropractic. That's my doctorate. But ever since chiropractic, since I finished my doctorate, I've been in the world of functional medicine. So my postgraduate education is all in the fields of functional endocrinology, functional blood chemistry, functional immunology. So there's quite a bit in this world of in functional medicine. So if for those of you who haven't heard of functional medicine is nothing new. It's really the easiest way to explain functional medicine is a practice it's a practice of healthcare, I guess we could call it that, where we're blending advanced diagnostic laboratory science, advanced testing with natural medicine. So I always like to say functional medicine is where science meets natural medicine. And we have the technology, and functional medicine takes advantage of the advanced diagnostic testing that we have. So it's really, we live in this world where we have all these common diseases, and it's really just the tip of the iceberg. It doesn't say anything about the disease or the disorder, but functional medicine works on all the mechanisms and the problems that create these common diseases through lifestyle efforts as much as we can. Sometimes it's pharmaceuticals. We'll refer that out our clinic. So that's the functional medicine, to summarize, I guess. And things like the thyroid are really where functional medicine, if it's done thoroughly enough, can be extremely effective, because you're going to learn here today that there's a lot to the thyroid. It's more than just this little gland. So what are we going to discuss here today? Well, I always like to put a little bit of an agenda so we know where we're going with our presentation. I want to talk about some common and uncommon symptoms of hypo and hyper. There was a video I did it was a small, very exclusive aspect of the thyroid. I did a YouTube video, and there was a significant amount of interest in it overnight. And it was because people weren't given the answers. So I'm going to talk a little bit about that today. So symptoms are one thing that people aren't always sure of, if they are hypothyroid or if they are hyperthyroid, and it can be kind of messy. I want to talk about some of the causes of thyroid disorders, because the thyroid is more than just the thyroid, and there's many causes. Functional medicine looks at what are these causes, why do they happen, and how do they happen? And if we know the why, we have opportunity to correct a lot of it, if not all of it. I also want to talk about what can you do. Now, it is going to be limited in the what can you do section of this presentation today, because you're going to learn that the thyroid is very unique for everybody, and there's no one size fits all. So when you're looking at content and floating around the internet or strategies your friend or your neighbor used, take these strategies with a grain of salt when it comes to the thyroid, because the thyroid is extremely complicated, and there's very seldom one size fits all. I have never seen that in medicine ever. So it has to be customized. I can't give protocols and plans if I don't know anybody, but I can give you some strategies and things to look at and to investigate. So some of you watching this today, you probably have lab tests, and maybe some of you don't have any lab tests. So I'm going to kind of walk through both of it. And at the end, I'm going to talk about some free resources that I have posted all over the internet that you can take advantage to get deeper information on thyroid and other health related topics. I did that exclusively for people's benefits, so it's completely free, but I'll get to that at the end. So why are thyroid disorders so important? Oh, this is a big one. And another thing I like to start off my presentations where people have a better understanding of why they should really pay attention to these things. So if you're listening to this, watching this, you probably either you have a diagnosis or you're close to it, or there's no diagnosis, there's a concern. But why are these disorders so important? Well, right now, thyroid disorders as a whole affect more than 20 million Americans. That's just the US. And we suspect there's a lot more that aren't diagnosed. Their thyroid hormone is necessary for all aspects of metabolism. So there isn't one tissue in the body that isn't affected by thyroid hormone. And this is very unique to the thyroid. And once the thyroid starts shutting down, it creates other problems. I always like to use the domino analogy. So when one system shuts down, it puts stress on another system and then another system, and the dominoes keep tipping over. And what we really notice in our symptoms is a final domino that tipped over. And then we're like, oh, this is the problem. No, the first domino is the problem. So you kind of untangle the web of chronic illness and causes. But thyroid disorders are very high on the hierarchy of health-related problems. You've got to rule it out. You've got to fix it. I mentioned thyroid hormones affect every tissue in the body. This is quite unique. There's very few hormones that do that. And to have optimal health, you need to have optimal thyroid function. It's not even optional. Now, not everybody has a thyroid disorder, but we're talking about thyroid today. And it's not, even though they're quite common, there's many other aspects to many of the symptoms we're going to talk about. So first I'm going to get into, I tried to separate it from hyper and hypo. So hyperthyroidism, the symptoms for hyperthyroidism, hyper meaning high, are very vast. But I wanted to separate these. There's most common and less common. So the most common that I see, some of the most common that we see, difficulty falling asleep or staying asleep. Many things can do this, but hyper can do this. Coarse hair growth. So hair that grows really thick, or sometimes people even grow hair in parts of their body they never did before. Damp and clammy skin. It's really damp, moist, and clammy. You see quite a bit of that. Irritability. Irritability can be a symptom, but can be a symptom of many things. Heart palpitations. You won't see heart palpitations with hypo, low thyroid. You'll only, if it's a thyroid issue, it's only going to be hyper. Everything's moving faster. So the way to really determine which symptom you are, or what symptom if you're hyper or hypo, there can be a mix, which I'll talk about, but pay attention to if anything is speeding up in your body. If there's a thyroid problem, it's going to be a hyper problem, hyper, high thyroid. If things are slowing down, any system in the body, there's probably a better chance it's hypo, low thyroid. And 90 to 95% of all thyroid cases are hypo, low thyroid. There are some that are hyper, and I'm going to talk about both disorders here today. Anxiety and panic attacks. You're going to see this more so with hyper, if this is a thyroid problem that's contributing to it, than hypo. It's actually a very common symptom in hyper. Inability to gain weight. So very thin and lanky individuals, body types, that's going to be more hyper. Diarrhea, even digestive tract is moving fast and stuff's moving through really, really quickly. Less common are bleeding disorders, but they can exist. Erratic menstrual cycles, excessive sweating. Remember, everything is speeding up in the body. Headaches, infertility, muscle tension and tightness, cervical spine, neck, and thoracic region, mid-back. Hypertension. You will see a lot of higher blood pressure with hyper, because it's like these people are running a marathon, but they're not running. So the whole body is being overstimulated. Chronic pain and a goiter. If you've ever heard of goiters, goiter is just a fancy name for enlargement of the neck. And specifically, it's associated with thyroid disorders. You can have a goiter if you're hyperthyroid or hypo. It can be both. It can be either, depending on the mechanism of the disorder. Now, symptoms of hypothyroidism, the one that's more common, much more common as a disorder. The most common symptoms with hypo are weight, naturally. Everything slowing down in the body, so you can't burn calories. Fatigue, weak, brittle nails, thinning of hair, dry skin, chronic joint pain. Again, this is a hyper symptom as well, so there's overlap with these things. Constipation. Constipation is actually a pretty common thing in hypo, low thyroid, if it's not being managed. Less common. And constipation, for those of you who are listening, what's the definition of constipation? I like to say it's not having at least one bowel movement a day, that where your body feels empty, that it's emptying. Now, less common symptoms are infertility. But it can be a hyper thing, but I see a lot of it in hypo. Mind you, I have many more cases of hypo in my office, so my sample size is definitely skewed to hypo. Slow wound healing, everything slows down. Impaired sleep-wake cycles. Thinning of the outer 1/3 of eyebrows. This should probably be in the more common symptoms. So the outer 1/3 of eyebrows getting thinner and thinner and thinner. Very, very common with hypothyroidism. Irritability as well, and again, a goiter. So I'm trying to go from hyper to hypo to hyper to hypo. So you see the flavors of both, and then we'll blend them together. Now, the causes of high thyroid function, there's a lot. The causes are where the magic is. If you understand the cause of the problem and identify the cause, then you have opportunities for solutions. That's a big mistake being done with thyroid and so many hormonal disorders in the body with our more modern, conventional, I don't even want to call it modern, it tends to be outdated on many things, conventional medicine, is they're not asking the why. They're not even asking the cause. And then people suffer their entire lives. So autoimmunity is a cause of hyperthyroidism. Now, autoimmunity, where your immune system is attacking your tissue or doing something, it's attacking or mimicking. So the immune system comes in and stimulates the thyroid. Autoimmune hyperthyroidism has a name, and it's called Graves' disease. Okay, maybe you've heard of that. So Graves' disease. The immune system is acting like your thyroid. Okay, remember that. I'll bring up this little diagram. So the immune system comes in and acts like your thyroid, and or a cause of hyperthyroidism is a pituitary tumor. This is a tumor on the brain. Now, tumors are interesting, benign or malignant. They whatever they attach to, they act as. So they're a mimicker. So if you have a bone tumor, most bone tumors adheres to bone. They grow off bone. They act exactly like a bone does. They'll do everything a bone does. If they attach to a certain part of the brain, they'll do everything that part of the brain does. So if a tumor attaches or grows or starts growing off the pituitary, it's going to act like the pituitary, and it's going to give extra hormone that the pituitary gives. So the pituitary gives, say, this much hormone, add a pituitary tumor on it, and now you got this much hormone coming off that pituitary. So you can get an excess of hormone. So two ways you can get hyperthyroidism. One is autoimmunity, that's also known as Graves' disease with hyper, and the other one is having a pituitary tumor. And then you get excess stimulation from your pituitary to your thyroid. So then your thyroid overperforms, creating the hyperthyroid state. Now, over here, there is this little bit of a diagram, but I want to explain it with my cursor, because I'm pretty sure you can see my cursor. So the stimulation, or you could just look at me in the picture. So the stimulation for a thyroid order, it comes from a high level of the brain called the hypothalamus. And then the signal comes down to the lower part of the brain, and that's called the pituitary. It's about eye level. And then from there, the stimulation comes down to the thyroid, and then the thyroid makes two hormones, T3s and T4s. Now, I'm going to do the cursor here on this because I don't care for this diagram. The hypothalamus sends a signal called thyroid releasing hormone to the pituitary. And then the pituitary sends a signal called TSH, which most people would have heard of, to the thyroid. This is the order of stimulation to get the thyroid to work. So it comes from way up in the brain. And then the thyroid gets stimulated. If there is a tumor on this pituitary, there's more TSH that's stimulating the thyroid. This is thyroid stimulating hormone. You get excess TSH, and naturally the thyroid makes more hormone. So that's one way, and that's a pituitary tumor. The only way you can rule out pituitary tumors is with an image. And then there is the second one is the immune system. So the immune system stimulates the thyroid gland, and then the thyroid gland puts out more hormone. So the information, the stimulation from the thyroid to the thyroid should only come from the pituitary. It's controlled. The brain decides how much the thyroid is going to be stimulated and the corresponding hormone being made. But if the pituitary is doing its thing, the brain's doing its thing and stimulating the thyroid, but then the immune system comes in there and stimulates it, gives it extra stimulation, then you get a whole bunch more hormone, and specifically T4 and T3 hormones. And so two mechanisms to end up with hyperthyroidism: a pituitary tumor and or the immune system jumps in and overstimulates. Then you make too much T3 and T4, and then you end up with an excess of T3 and T4. And these are thyroid hormones, which create the metabolism and everything and put people into a hyperthyroid state, too high of thyroid. Okay, so two mechanisms. Hyperthyroidism is relatively simple to figure out, but it is very, very, very severe. It can, if your thyroid is running too low or too high, it can actually be deadly, especially hyperthyroidism. People can go into cardiovascular attacks, like heart attacks. It can get so, it just turns everything up so high. So now the causes of hypothyroidism. So it was hyper, now hypo, low thyroid. This is a little bit more complicated. Autoimmunity as well. Autoimmunity as well can create hypothyroidism. And it should be the first thing that's ruled out when we're trying to understand our thyroid. Is your immune system a culprit? But autoimmunity for hypothyroidism has a different name. But it's called Hashimoto's. So hyperthyroidism, autoimmune hyperthyroidism is called Graves' disease. Hypothyroidism resulting from autoimmunity is called Hashimoto's. But again, in the hyperthyroid state, not every form of hyperthyroidism is due to autoimmunity. Same with hypothyroidism. Not every cause of hypothyroidism is due to autoimmunity. So there's a few things. Autoimmunity is one that causes hypothyroidism. I'm simplifying this for our presentation today. Autoimmunity is one. You should rule that out. You can do it with a lab test. And then the second thing is you got to make sure there's no thyroid dysfunction. Liver dysfunction, whether that's toxicity or liver injury. You got to make sure. And I'm going to show you how liver plays into the thyroid. Or digestive disorders of any kind. If you have a liver dysfunction or a digestive function, you are not going to have proper thyroid function. It's impossible. It's absolutely impossible. And there's some other things. I don't want to get into them, like goitrogenic foods. We used to think this was a big, big thing, Brussels sprouts and broccoli and bok choy and all those. No, they're actually not that big of a deal. And if we have to avoid certain foods to get our thyroid to run, like goitrogenic foods, those are healthy foods, by the way, you lose a lot of nutrients. So I don't even like to talk about goitrogenic foods. But what is another thing that's relevant is toxins. Toxins that are like halogens. So halogen, if you look on a periodic table of elements, it's a certain group of elements that have similar characteristics. Iodine is a halogen. Now, iodine has a little chair on the thyroid. Iodine comes in and plugs into the thyroid and helps the thyroid make its hormone. We need iodine. But halogens are almost identical to iodine, and they can steal that chair. Most commonly, bromine, chloride, and fluoride. They will sit in that chair and steal the chair from iodine, and then the thyroid isn't able to work. So toxins do play a role, halogen specifically, in interrupting and interfering with your thyroid hormone production. Now, back to this little graph here, this little diagram here. So now we're going to talk about the scenario with low thyroid. So now that you know thyroid function starts in the brain, the hypothalamus, and then down to the pituitary, and then the pituitary releases TSH, and TSH stimulates the thyroid, and the thyroid makes T3s and T4s. So with what happens is T4 and T3, these are both two hormones that are coming out of the thyroid. The T3 is the active hormone we can use. But the problem is the thyroid doesn't make a lot of T3. The majority of what the thyroid makes is this form of T4. I believe it's almost 90%, right around 90%. And only about 10% is the T3. So 10% of T3 is not enough. We need to use this T4. So proper thyroid function is T4 goes to the liver and the gut, and then it is converted. It's converted in the liver. T4 is converted in the liver and the gut, and then it converts into T3, something you can use. So if anybody has a liver issue or a gut issue, you can't convert this useless T4 into T3, something you can use. And what's coming out of the thyroid directly to T3 is only about 10% of overall thyroid production, hormone production. The majority of it's T4. So we got to use the T4, and we have to be able to convert it. I got a lot of people that'll come into the office and they have, their T3 is super low. And it's because they're not able to convert their T4 in the liver and the gut. And what does this mean? Gut and liver, so many different things that toxicity, recreational drug use, alcohol, processed food, a low energy will create a toxic liver because the liver requires energy to clean it out. So you just have to have lower energy and you'll have a toxic liver. So many things that compromise liver function. And I'm not even getting into pharmaceuticals. And digestive functioning, they say there's over 75% of the American population are dealing with some digestive disorder. So it's kind of no wonder why there's over 20 million Americans dealing with a thyroid issue. Conversion of T4 into T3 is a major cause. Okay. So the next thing is hypo and hyper. But can you have both? Yes, you can. Yes, you can. You can actually have both symptoms. And I'm going to explain this. This is an immune problem. When the immune system damages the thyroid, think of the thyroid as a balloon. When it damages and chips away and eats away at the side of the thyroid has a balloon full of hormone, thyroid hormone. But when the immune system's damaging it, you can actually break open the thyroid and it'll spill some hormone. Now, this is on a cellular level. You're not going to notice something in the thyroid that's broken, but it'll spill the hormone. You get all this T3 and T4 that jumps in the bloodstream, and it's like rocket fuel for the body. Your heart rate bounces up, everything, you start sweating. It's very, very dangerous when you spill this hormone. But prior to the immune system, a lot of people will be in a low thyroid state, a hypothyroid state, and they have Hashimoto's, and they're diagnosed low thyroid. They're given medication, but then the immune system, if their autoimmunity isn't being managed, their immune system can damage the thyroid to such an extent to spill the hormone, and then they were low, and then they get a crazy surge of high thyroid. They can't sleep, they're irritable, they're sweating, they're anxious, they're diarrhea, they're just a mess. And until that body burns up that excess hormone that was spilled and free into the bloodstream, once it burns off, then they start coming down and they go back to low. These individuals have Hashimoto's, autoimmune hypothyroidism, but then they get episodes of spikes. And this is very dangerous, and it's called uncontrolled Hashimoto's. That's what I've named it, uncontrolled autoimmunity, where these people should be staying in a hypothyroid state, but they get these nasty surges. And I've had quite a few in my clinic over the years that they come in with the complaints of they're given this amount of medication, but every time they test, they get symptoms of hyper, and then they go to low. But they get these surges, and it's very frustrating because they always go to the doctor, and the doctor's trying to change the medication. So they have a hyperthyroid, and they go in, the doctor pulls the medication. So I don't know what's going on. And then they get into a low state, and they're struggling to get through their day, and they have to increase their dose. So the dosages go up and down and up and down. They're trying to keep up with Hashimoto's, but they can't. They can't do it. So then sometimes it gets so bad where the doctors say, oh, we just got to pull the thyroid out. And then there's no going back. And then they're given medication, and there is a place for medication. But the medication, if people are on medication for too long and they don't need it, that's a question. A lot of people need it. But if they're on it for too long and they don't need it, their thyroid shuts down. And when their thyroid shuts down, because if your thyroid doesn't have to make hormone, it's not going to make it, and it gets lazy. So if you don't use your thyroid, you lose it. So long-term medication use a lot of times can make the thyroid not want to work. So, but there's a place for medications. I think it's a lifesaver. It just needs to be done right. So here's kind of what I was talking about. Here's the thyroid. Imagine this, where this Band-Aid is. There's an injury, and and then there's a bloodstream. So the thyroid will spill hormone out of this injury directly into the bloodstream. That is uncontrolled Hashimoto's. So the thyroid was being injured, so they were in a low state. Then it ruptures the thyroid, and then they go into a super high state, and then they burn up that hormone, and then they go into a low state, and it's impossible to get the medications right, but you can control it. You can control it. But this is an example where people can have swings in hyper and then hypo, and then hyper and then hypo. It's uncontrolled Hashimoto's. Okay. So what can you do? This is a big one. What can you do effective? The solutions for them to be effective, they have to be specific. So for the individual's problem, there's no cookie cutter. Conventional medicine is a cookie cutter approach. It's take this drug or this drug. There's no thought process in the strategy of the why. And sometimes there is a place for drugs, but the thyroid, you usually need both. So the most important thing is you have to test to confirm the problem. Is it a hyperthyroid problem? Is it a hypothyroid problem? If it's hyper, is it a pituitary tumor, or is it Graves' disease as the immune system? If it's hypothyroidism, is it a conversion problem from T4 to T3, a liver or gut problem, or is it an iodine problem, or is it autoimmune problem like in Hashimoto's? So the tests are required. This is just standard. And you can order any test without a doctor. You can go right on our website and order any test you want. You can visit our website right here, and I'll talk about that. But this is the page, our web page. You can actually order. There's some exclusions. I think New York, and there's a couple states, but the majority of states you can order. It's all on the web page. You can reach out to us if you have any questions, but you can actually get answers, because the medical community tends to only do TSH. Sometimes you get a T4. So it's really your choice. You test or you guess. And conventional medicine, again, only orders 1 to 2 thyroid tests, but there's panels on that page that are the full 12 panels, the 12 thyroid tests to learn the whole story of the thyroid. That's what we do on almost everyone. We rule it out. So here's a complete thyroid panel. This is everything here. I don't have iodine on here. I don't have to order iodine very often. And then over here is what conventional medicine tests. Sometimes you get a T4 or T3, but it's very limited. And they don't need to dig very deep in the thyroid when it comes to testing, because they're not looking for the why of the problem. If it is Hashimoto's, they don't have any other solution. If it is Graves' disease, well, that's both of these. Everything we're talking about today you should have a medical doctor involved, because if medication is required, natural medicine isn't enough. And I think that's very important. People always do the best if they have access to both natural integrative medicine and pharmacology medicine. And you use the pharmacology when necessary, but it's not the long-term strategy. It's to get out of the acute stage if someone's in it. So if someone has hyperthyroidism, you diagnose, you do the lab test and you find out hyper. This actually means low TSH. So low TSH means hyper, high TSH means hypo. So if someone has hyperthyroidism, what do? Well, testing again is number one. And then if you diagnose hyper, if it's autoimmune disease, well, then what do? You got to have a medical provider on this. Sometimes the immune system is overstimulating the thyroid so much, you need radiation. You need to shut that thyroid down because it's destroying the body. So you do need medical providers, and in any of this stuff, you should have access to one. In fact, our clinic, we make sure that everybody has access to a medical provider is working with a medical provider, because we have to have both sides of the aisle. If it's autoimmune, Graves, you have to manage it. You can't cure autoimmunity, but you can manage it. In our clinic, we're doing this every day. We have so much autoimmunity in our clinic. But there's a webinar I'll talk about, a workshop on. I just talk about autoimmune and how to manage it. It's a beast. It's a big, big story. And if you get a natural provider that's going to start helping you manage your autoimmunity and control it, it has to be a comprehensive approach. There's no vitamins. There's no fancy supplements. There's none of that. There's no fancy one food or 6 foods to remove that's going to correct autoimmunity. It's a big, big picture. So it has to be a doctor that's really going to roll up their sleeves and dig into it. Otherwise, they're not going to be successful. And a medical provider, as I mentioned. If the cause is unknown, you go to the medical provider and they say, oh, we don't know the cause, don't accept it. Get a second opinion, get a third opinion. There's always a reason for hyper. Never accept, we don't know. Respect it because they're being honest, but go find another opinion. If it's hypothyroidism, if you do the test and you have high TSH, this is a diagnosis of low thyroid. Well, what do? Well, if it's autoimmune, like Hashimoto's, again, it has to be autoimmune management, just like Graves, and hopefully it's enough. Graves tends to be more aggressive than Hashimoto's. But again, watch the autoimmune workshop, get a natural provider. You've got to be very comprehensive. And when I say comprehensive, you have to look at everything. You have to look at physical immune irritation, chemical immune irritation, and emotional immune irritation, because when the immune system attacks yourself, and in that webinar or that workshop, you'll hear all of this. When the immune system attacks yourself, it damages your own tissue, whether it's thyroid or your joints or whatever. The thyroid isn't the problem, and the joints aren't the problem. It's the immune system. And you can manage autoimmunity if you identify what's irritating your immune system. Because if you can reduce irritation to the immune system, your immune system doesn't damage you as much, doesn't injure you as much. And it can be very, very powerful if your autoimmune strategies are thorough enough. But you got to look at all this stuff. And you have to test and identify, where are these immune irritations? Environmental, chemical, food, lots of different irritants when the immune system gets mad at yourself. Now, I wish this was mine. It's not mine. It's a colleague of mine, so I have to give him credit, Dr. Detoxify. He's absolutely brilliant. But he put this together, and he talked about, how do you manage autoimmunity? And he did this to kind of give a overall approach. It's big, as you can see. So don't think you're going to go work with autoimmunity. It's going to be a one-day thing. It's going to be somebody to get you on the right page and something you're going to follow for life. But it's going to be powerful. And I have 2 autoimmunities. And in fact, I have one we're talking about here today. I have Hashimoto's. So far, I don't have to be on any medication. And I definitely don't have the surges in thyroid, any of that. I don't have any symptoms. I caught it with screening myself. Something I recommend everybody and anybody, just screen yourself, catch it early, and you can take care of it. But there's a few different levels of management. One is the big one. People have to know what to do. They have to look at foods, chemicals, all of those. You have to even look at relationships and stress. Is someone sleeping or are they not sleeping? All of these things are immune irritants. Dietary, there's lots of different foods that cause problems. You should know which ones and not just have to avoid every food that there is. You also have to look at bacteria and viruses and parasites and mold and all these other things, because those are immune irritants, antigens, and irritations. And then chemicals play a role. Making sure there's no leaky gut. I know I've done videos all over the internet on leaky gut on our YouTube channel. And then downregulate and restore immune tolerance, oral tolerance. So that's just the first step. And then you have to have a strategy if there is something flaring it up. And then, of course, there is a place for pharmaceutical intervention. So you can don't underestimate the comprehensive nature required to manage autoimmunity. But if it's done, the rewards are life-changing. Okay. And it's impossible for me to talk about thyroid dysfunction if we don't talk about autoimmunity, because there's so much of it. So if it is hypothyroidism, high TSH, again, physical, manage it, manage autoimmunity, make sure there's a medical provider. But again, medical providers with things like Hashimoto's, they're limited. In fact, they don't have any strategies for Hashimoto's. They just have strategies for low thyroid, hypothyroidism, regardless of the cause. And that's just add another medication in. And sometimes it's absolutely necessary. But there should be a longer term strategy. If non-autoimmune hypothyroidism, again, not all hypothyroidism is the result of autoimmunity, and not all hyperthyroidism is the result of autoimmunity. But if it's not autoimmune, and you test to know this, investigate liver and digestive functioning, as I mentioned. You have to be able to convert T4 to T3 to have proper thyroid function. So this has to be investigated. And if the doctors say we don't know, don't accept. Don't ever accept the unknown, the not having an answer for autoimmunity, or I should say any thyroid issues. There's always a reason. So thyroid disease and autoimmunity, it is pretty significant. Again, I can't talk about thyroid without talking about autoimmunity and giving a little bit of background on it. But hypothyroidism can be induced by many different diseases. Autoimmune causes accounts for almost 90% of all adult hypothyroidism. Most of it's Hashimoto's, like I have. The majority of Hashimoto's patients are women. Autoimmunity loves women because autoimmunity loves estrogen. And with euthyroid means, subclinical thyroid numbers, patients progress to hypothyroidism. So they might be on the line, but if it's not being monitored, changed, corrected, optimized, your thyroid does decline, according to the research. So get it checked because it's so important. So this takes us to some free resources. Now there's quite a bit. There's quite a bit here. And you probably saw my dog in the background. Here's my little mascot. I was wondering why I'm talking to the computer. So some free resources. This is all on our page. Just visit our website. There's over 150 how-to health videos. I even explain on what labs to order and why you would want to order them and when you wouldn't want to order them. So I try to walk people through the diagnostic efforts so they can do it on their own. When I put this website together, the goal of it, with all the labs and everything, the goal of it was people that I'm working with, if they know enough about their labs, I don't want them to have to make an appointment just to get a lab. If they understand how to read the lab, but they should have access to this stuff so they can be as health independent as possible. So that was the purpose of it. Anybody can order it. Almost any state can order it, but take advantage of it. Also, there's a podcast that I've been working on over, well, I think we've been a couple of years now. We've been putting it together. A colleague, Dr. Colby, and myself, we've been putting together this podcast called Brainstorming with the Docs. There's a video version of it, but it's on all the platforms, all the podcast platforms. This is where we've interviewed people. We talk. The focus of the podcast is breaking barriers and bridging the gaps between patients and doctors. A lot of times doctors don't understand their patients, and a lot of patients don't understand their doctors and what they're going through. So both parties need to see what's going on. And we're steady brainstorming cases and disorders and dysfunctions and mechanisms. So if you really want to get geeky into a lot of the science behind the causes of health problems, this is a really good podcast. So every week there's a new one. I think we're 70. I think we just put out 70 the other day, number 70. So that's weekly. And all these links are on our page. And then there's these workshops. I highly recommend taking advantage of them. These are right around 1 hour, and they're on many different topics, and they're all, again, on our website. There's one on the thyroid, and I get into the thyroid really, really deep into this presentation. I draw out the mechanisms, I draw out different scenarios. But remember, when you're looking for health information anywhere from anybody, it's concepts and versus protocols. Protocols do not work for these. Okay, Dr. Jim said, everybody with a thyroid issue needs a bunch of iodine. That is madness. There's madness. They don't know everybody. Does anybody have an iodine problem? So be very careful with protocols when it comes to comprehensive and complex systems like the thyroid. Be very careful because some of them can cause problems. But understand the concepts and dig deeper and deeper and deeper and learn about yourself, not just a generic, analyze yourself. There's one on thyroid. There's one on the adrenal health. And thyroid is much deeper than what we could talk about today. There's one on adrenal health. I make a connection between blood sugar, dementia, and insomnia. There's a close connection between all three of these disorders in adrenal health and energy. Toxicity, this is a pretty big one. I talk about internal toxicity and what happens to our bodies. Hormones, this one, I'm introducing concepts of how hormones work so then you can apply them to any hormones. So it's really, 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 really interesting. And immune health, this was really big during the start of COVID because everybody was worried on, how to increase their immune health. And it's still a popular workshop because people don't understand how their immune system is being compromised with simple things every day. And autoimmunity, this is one that I reference. This is something you probably want to watch if you want to learn more about autoimmunity and the complexities of autoimmunity. And in the brain-gut connection, a lot of people like this one because so many people are fascinated now or before, they're still fascinated, how the digestive system plays directly into brain function and mood and anxiety and all sorts of emotional disorders. You correct the gut, you will always influence your emotions. And it's in the research all over now. It's not just a theory. We actually have figured it out. So it's a really good one. But all of these are free. I think you need to sign up for them on our website, but they're all free. Okay. And we went through a lot here today. And when we talk about all of these disorders and all these complexities and lab testing, and I'm an advocate of everybody taking care of themselves. But sometimes when people are listening to me rant about certain issues, they get overwhelmed. And they're like, wow, there's just so much to this. I don't know if I want to dive into it myself. You can always schedule a consult with us. Where, when people are diving into this, and for our consult, we always discount it if people have shown interest and watched our presentations and things like that. I know they're serious. We offer a consult. This is where we look at all your past lab work and history, and I send you a bunch of paperwork and we get that in advance. So I look at your whole case. And then we schedule an appointment, and most of these the consults are being done via video. But I'll know all about your case before we even have this appointment, because otherwise I wouldn't be able to contribute to the conversation. So I need to do my homework first. And this is a full hour. And at the end of that appointment, usually if people don't have enough lab work, we'll order labs. If people have enough lab work and we have an understanding, well, then we can jump right into it. And I can start laying out how we're going to work on your case, what my thoughts are and theories, and how we're going to do it. We don't start care this day, but it's more of a discovery day, trying to figure out what's happened and what is the story. But we do dig into that. And I allow an hour for whether we need it or not. Our hourly rate is $307, but we cut it down for a consult. We've been doing this for years now. It's cut down to $97. So it really breaks it down, but people have the opportunity to actually get some insight on their case and an understanding of what's going on versus my lab tests are normal, but I still feel like, I still feel bad. I still feel like crap. There's always a reason. So in summary, if there's anything that you should take away from this presentation, if there is a thyroid disorder, never accept we don't know why. Just take the medication. Don't accept that. Don't accept. If you're feeling better, great. A lot of times people aren't feeling any better. And don't accept that. There's always other doctors. You can reach out to us. We can have a consult. We can dig into it and find the mechanisms or advise you on the lab tests that need to be done. There's always a way. The thyroid is extremely important. It's the number 2 or the number 3 on a hierarchy of systems that need to be working properly in your body. Glucose is very high on the list of importance. There's a hierarchy of things you need to check off when you're working with a patient. Number 1 is ruling out all forms of anemia. That's the most important thing out of anything on a lab panel. The second one is usually blood sugar. Does a person have a diabetic, pre-diabetic, or do they have blood sugar crashes? And then the third one is thyroid. And then there's everything below that, all the sex hormones, all of that. That's on all, even digestion is all below that. So as I'm explaining this, high level system is the thyroid. So don't ignore it. We understand it now. There's ways through it, and you have access to all the testing. It's all on our website. So anyway, I hope that was helpful. Look at that. 47 minutes. I'm still holding my own. Next month, we're going to have another one. If somebody is that's listening to this is really looking for a certain topic that needs to be addressed, or they can't find anything on our website or 150 videos on YouTube or whatever, you can always send us an email and go on our website. Everything is there, or call us. Send us a message of if there's some new content that you really feel that needs to be addressed. Or if you have any questions about what we talked about today, or directions on our webpage of labs, etc., or set up a consult, you can all do that. So with that being said, I'm Dr. Harrison, and I hope you have a great day, a great evening, and I look forward to our next presentation. Okay, have a good night.